General management of the poisoned patient, Rrsidead mnemonic. We use the Rrsidead mnemonic, an essential framework to systematically assess and treat poisoning cases. 1. R. Resuscitation. First, we focus on ABC, airway, breathing, and circulation. Many poisoned patients present with altered mental status, which means airway protection is key. If the patient is hypoventilating from sedative or opioid overdose, they may require bag mask ventilation or intubation. Similarly, cardiovascular collapse from beta blockers or calcium channel blockers demands aggressive resuscitation. 2. R. Risk assessment. The next step is to identify the toxic agent, dose, time of ingestion, and patient factors. This helps us predict toxicity severity and guide management. For example, a paracetamol overdose at 4 hours needs NAC based on the nomogram, while a digoxin overdose is managed based on serum levels and clinical signs. 3. S. Supportive care. Most poisonings don't have specific antidotes, so supportive care is the cornerstone of management. IV fluids, oxygen, vasopressors, seizure control, and correcting metabolic abnormalities can be life-saving. 4. I. Investigations. We must send targeted blood tests and ECGs. Commonly ordered tests include paracetamol levels, salicylate levels, and blood gas. An ECG helps identify QT prolongation, sodium channel blockade, or bradycardia, which gives clues about the toxin. 5. D. Decontamination. Decontamination should be considered early in certain poisonings. Activated charcoal can reduce absorption if given within 1 hour, but it's contraindicated if the patient has an unprotected airway. Gastric lavage is rarely used today but might be considered for massive overdoses of life-threatening toxins. 6. E. Enhanced elimination. Certain drugs can be removed faster using urinary alkalinization, for salicylates, or dialysis, for lithium, methanol, and toxic alcohols. Knowing when to initiate these interventions is crucial. 7. A. Antidotes. While supportive care is the mainstay, specific antidotes can be life-saving. Examples include naloxone for opioids, NAC for paracetamol, digibine for digoxin, and lipid emulsion therapy for LAST. 8. D. Disposition. Finally, disposition depends on severity. Some patients need ICU admission, while low-risk cases can be discharged with psychiatric assessment for deliberate self-harm. In summary, Rrsidead ensures we take a systematic, structured approach to every poisoned patient. Now, let's apply this framework to our case discussions.